Flu admissions up 9%. What's really going on with the NHS this winter? Hello everyone, and welcome back to the channel. Today, we're talking about flu, winter viruses, and the NHS, but without panic, without scary headlines, and without confusing medical language. You may have seen the news saying flu cases are rising again, hospitals are under pressure, and winter is far from over. Some headlines even talk about a super flu or a crisis. So let's slow things down and ask a simple question. What is actually happening, and how serious is it? Let's look at the facts, explain them clearly, and put everything into perspective. After Christmas and New Year, flu cases in England have gone up again. Last week, an average of 2,924 people per day were in hospital with flu. That is a 9% increase compared to the week before, when the number was about 2,676. Health officials believe this rise happened because people mixed more during the holidays, visiting family, attending parties, and travelling. When people mix more, viruses spread more easily. That part is very normal. This rise is being called a bounce back, meaning flu cases dropped a little, then went back up again. But here's something important. This is not a record-breaking flu season. According to official government data, flu is currently described as circulating at medium levels. What does that mean in simple terms? Right now, flu rates are around 20 cases per 100,000 people. In past bad flu seasons, like in 2017 to 2018, flu rates went as high as 56 per 100,000 people. So compared to those years, this flu season is milder. It did start a little earlier than usual, and it has had more than one peak, meaning it went up, down, and now up again. But overall, this is not the worst flu year on record. So if flu isn't extreme, why does it feel like the NHS is in crisis? The pressure on the NHS is not just about flu. Hospitals are dealing with many problems at the same time. Flu, COVID-19 RSV, which affects breathing, especially in children and older people. Norovirus, also known as the winter vomiting bug, and very high demand for emergency care. On top of this, the NHS already runs almost full all year round. Hospitals don't have many empty beds waiting for emergencies. So when winter comes, even with normal levels of illness, the system struggles. Think of it like a bus that's already full. If even a few more people try to get on, there's a problem. Right now, hospital bed occupancy is around 95%. Experts say safe levels should be around 92% or lower. That small difference matters a lot. One major reason beds stay full is social care shortages. Many patients are medically fit to leave hospital, but they cannot go home because there isn't enough home care support, or there are no available places in care homes. So patients stay in hospital longer than needed, even though they don't require hospital treatment anymore. This causes a chain reaction. Fewer beds available, longer waits in A&E ambulances delayed outside hospitals, and sometimes patients treated in corridors. This is not caused by flu alone. It's a system-wide issue. The government says it is taking action by putting more money into winter NHS services, increasing ambulance funding, expanding NHS 111 services, training and recruiting more health workers. These steps help in the short term. But many doctors, nurses, and health experts say this does not fix the long-term problems. They point to long-standing staff shortages, burnout among NHS workers, low pay, and difficult conditions in social care. Not enough hospital beds for the population. Without long-term planning and investment, the same problems return every winter. You may wonder, if flu levels are medium, Why does the messaging sound so dramatic? Government and NHS leaders say strong warnings are meant to encourage people to get vaccinated, ask sick people to stay home, reduce unnecessary A&E visits. Their goal is to protect NHS capacity. However, critics say this messaging can feel confusing or scary when the data doesn't match the tone. Many believe the public needs clear explanations, not panic. Health leaders are asking the public to help by getting flu and COVID-19 vaccines if eligible, staying home if you feel unwell, using NHS 111 or the NHS website for non-emergency advice, calling 999 only for life-threatening emergencies. These small actions can help reduce pressure on hospitals. So, let's sum this up clearly. Yes, flu cases have risen again after Christmas. Yes, hospitals are under real pressure, but this is not a historic flu emergency. The real issue is that the NHS is operating with very little spare capacity, ongoing staff shortages, serious social care problems. Winter viruses expose these weaknesses every year. What's needed is not panic, but clear planning, honest communication, and long-term solutions. If you found this explanation helpful, please like, share, and subscribe. And let me know in the comments. Do you think the problem is flu or the system itself? Thanks for watching.